Hello, everyone, and welcome to DNP-Derm, my YouTube page that I am starting officially today. I am Dr. Keisha Cash. I am a dermatology nurse practitioner. I'm dual certified in family practice and dermatology. And I am here because I am starting a YouTube page to inform all of you of kind of what's going on in the industry, how to get into the industry, and things you can do to kind of prepare yourself to be a part of the industry. So, DNP-Derm is a website that I created. I am creating it essentially because I want to be able to reach people to sort of help them along their journey in getting into the field of dermatology. Essentially, what my website will do is it will provide coaching sessions and areas for people who need speakers, maybe for dermatology conferences, or maybe you want somebody to speak about a topic related to dermatology. You'll be able to do that eventually, and hopefully I will hope to probably have some courses that will be available for people to take to get continuing education credits for. So we are very excited about this launch, this website. So, a little bit about me. I am a dermatology nurse practitioner. I've been practicing dermatology for about 6 years now. I got my dermatology certification. I am family practice certified. I also did family practice for about 6 years. And prior to that, I was an ICU nurse for 6 years. So I have been in the healthcare industry for over 20 years. And I have a pretty diverse healthcare background. It's basically kind of what I just mentioned. And so, I just felt like there was a void in terms of what was being offered to people who really want to know how to get into the industry, or maybe some references, resources that weren't available for people trying to find out specific information about maybe what it is you need to know, the skills that you need to be aware of, or skills that you need to have in order to land that job or position that you're looking for, or even content experts for people who need someone to speak at a chapter meeting or a conference or a health fair or at your school, or at skin cancer screening. So I created the website to be able to offer that to people who are interested, to people who want to listen, or people who want to be engaged, or people who want to be involved. So my website is DNP-Derm. The actual website address is dnpderm.org. On there, you will find information about coaching sessions, which is really my passion in terms of what it is that I want to be able to offer advanced practice providers, whether they be nurse practitioners or physician assistants, or you could be an LPN or RN that is considering making a change to the field of dermatology and kind of wanting to know maybe some of the things that you need to know, or some of the things that you should be looking to know in order to get into the profession or to get into the specialty. However, most of my focus would be on advanced practice providers. I really feel like there is such a gap in terms of what providers know when they enter into the field of dermatology. Unless you have worked in the field of dermatology, or you know somebody in the field of dermatology to kind of help and guide you, it's really hard to get into the field and knowing and understanding and or navigating the things that you really need to know to be able to be successful. And so for me, I just thought that this was very important for me to do, to be able to have a resource for those who are interested to be able to tap into, to kind of help them along their way, to guide their journey through this specialty or getting into this specialty. I really look forward to engaging with people as far as that's concerned. So I created the DNP-Derm concept, so to speak. I use that same title on my Instagram and Facebook handles. So you can find me on both of those platforms as well under the same name. And really just looking forward to engaging with other people. You can go on that website, you can book coaching sessions. Typically for a little period of time, we meet via Google Meets or Zoom, but we can get together and kind of find out what it is that you're looking for, what it is that you're hoping to get out of it, and I'll kind of help to guide you along the way through the rest of it. Information and tidbits that you'll need to know that will sure to help you to be successful in the near future. Some of the other things that I have on the website would be to be able to book if you need to have a speaker at a health fair or a career fair, or maybe at a chapter conference or at a conference in general. If you're looking for somebody who you want to speak on a subject related to dermatology, I am certainly available for that. And so you would just basically contact me through that website, and we would discuss dates and times, and then you would go on to the website to actually book those sessions and that availability. Some of the other things I wanted to talk about is eventually and in the future, we're hoping to be able to offer a little bit more in terms of an interaction and engagement with my followers or with the people that interact with DNP-Derm, maybe podcasts or introducing ways in which we can disseminate the information to everybody in a format that is engaging and interactive. So be on the lookout for some of those things as well. But to start, we're going to start with coaching sessions and speaker availability for people who want somebody to speak in person and or virtually. So we're in the day and times of COVID-19, so we kind of have to be flexible as far as that's concerned, but we are open to any of those things. So the other thing I wanted to talk to you guys about today was I wanted to kind of give you guys an update on what I've been doing. Those of you who don't know me, I am a part of the JDNA Editorial Advisory Board, which the JDNA is the Journal for the Dermatology Nurses Association. We get together once a year to kind of discuss what's happening with the journal, what's been the social media engagement, things we want to see in the journal moving forward, and how and better ways to recruit and interact and engage with our followers, with our membership. So today we had our annual board meeting. It was about 2 hours long. It was very informative. We talked about a lot of different things, but the main key points that I wanted to stress with you guys and for you guys to take away is be active, be involved in your organizations, your associations that you are members of. Being actively involved professionally will certainly be engaging for you as a learner, and also will help you to network with like-minded people such as yourselves. I find that being involved with the organization a little bit more as a volunteer has really helped to enrich my professional life outside of just my regular 9 to 5 of seeing patients. So I highly encourage that if you have not or you do not volunteer within your organizations that you are a part of, that you strongly consider that. It doesn't take a lot of your time or a lot of effort, especially if you enjoy what it is you do. And it's really fun to kind of meet other people that have the same passions and interests as you do. So I would highly encourage you do that. So talking about the annual board meeting today, some of the things that we discussed were potential topics that we would like to see in the journal moving forward. Some of the things that were mentioned was maybe a pharmacology column talking about some of the things that we need to delve into a little bit more. In particular, atopic dermatitis is like in the news now for all of the new medications that are coming out, JAK1, JAK2 inhibitors for the management of moderate to severe atopic dermatitis, and what that means for the person and or providers that would be prescribing that medication. Should they feel comfortable? What are the potential adverse effects, and what are some of the potential patients that you would use those type of medications in? So that was something that was brought up recently. So just wondering from you guys, like, what it is that you would want to see if we were to do something like a pharmacology column. What areas do you need help with? Do you need help with immunosuppressives? Do you need help with biologics and understanding the biologics and how they break down and when to use them? Do you need to understand the laboratory and diagnostic testing that you need to have done prior to and during treatment? So I kind of want to know what your thought process is on that. Some of the other topics that we talked about were possibly adding more articles about cosmetics and how, adverse events and or using cosmetics to ameliorate adverse events, or using cosmetics to treat other conditions. So one of the things we talked about was, the use of chemical peels and microneedling to help with acne scarring, or the use of laser to help with acne scarring. What are the indications? What are the adverse effects? What are the most potential qualified patients for procedures such as that? And when would you use that? Like, when would you use laser versus microneedling or chemical peels? And how to feel comfortable with that, and where to go to, maybe get those answers. So that was another thing that we discussed. Something that's near and dear to my heart would be the skin of color column. We are certainly trying to figure out a way to implement that within our content planning. As the COVID-19 pandemic kind of ravaged through us for the last 2 years, I think we all became very well aware that there are adverse effects and outcomes and skin manifestations that are different than maybe manifestations that occur in patients that aren't of color, and being able to recognize those differences and understanding what those differences mean, and feeling comfortable with what those differences are, and being comfortable with looking at skin of color patients, or understanding what their unique concerns and needs are, and how to address those needs. So the skin of color column is something that I'm looking forward to, that I'm looking forward to working on. We have a couple of ideas that we were spinning around in terms of what we want to see. And so I want to know again from you guys, if we were to implement a skin of color column, what type of things do you want to know? Hair care is being a big one, which I've started an article already on that. That's a majority of the practice that I see. If I see people coming in for hair loss, the majority of those patients are African-American females, typically between the ages of probably anywhere from 33 to 50, that are coming in and experiencing hair loss. And really the trauma of that, the psychosocial aspect, the decreased self-esteem, depression, and anxiety that can be related to that. And, really are the treatment options. How do you diagnose it? How do you go about determining what type of hair loss you have, and then determining how to treat that? So that's something that I'm really interested in, and really want to kind of know what your guys' feedback is on that, in terms of what do you want to see talked about if we were to do a skin of color column? What type of ideas, what type of diagnoses, what type of diseases, what things interest you that directly impact people of color? So that's another thing that we talked about today. We then also talked about maybe some other things that we really need to address, which is talking about the need for recruiting more reviewers. We are a peer-reviewed journal. We strive on that. That's the basis for everything that we do and publish. And I will tell you that I review a lot of articles for the journal currently. And oftentimes, doing the reviews are rewarding to me for many different reasons, but probably the thing that I enjoy the most is just kind of learning about different topics and subjects, and kind of helping the author through the writing process, so to speak, in terms of kind of guiding them and helping them to see things that might need to be fixed, or things that are fantastic about a manuscript. So encouraging you all, if you're not engaged in doing so, to consider doing so, to consider becoming a peer reviewer for the JDNA, to consider becoming a reviewer for any journal that really interests you. To be honest, it doesn't have to be the JDNA. However, doing some of those things, right? Doing some of those things, being a peer reviewer, can help you to get into the industry, can help you to understand some of the things that you need to know about being in the industry. Doing some of those things can help to be professionally rewarding for you. So I encourage you to do that if that's something that interests you. Another thing that we talked about was recruiting authors. We are at a point in the year where we need more authors, people to submit more manuscripts. And submitting a manuscript doesn't mean you have to submit something that's new. It just needs to be relevant. It needs to be current. So it could be something that maybe you wrote 2 years ago. It could be something that you wrote 4 years ago, as long as it's relevant content to what is going on today within the field or specialty. So We're looking for authors. We're looking for manuscripts. It doesn't have to be for a specific topic. It just has to be relevant to dermatology. So if you are thinking about writing something, or if you're not quite sure of what to write or how to write, you can hit me up after this stream. You can leave a comment. We can touch base and we can kind of figure out what it is that you need to do. You can also write up a lecture or a presentation that you gave. It could be a school presentation. It could be a DNP project. It could be a master's thesis. It could be any of those things that you could consider writing or submitting to the journal for the betterment of us as a profession, for the betterment of us as dermatology nurse practitioners and PAs. So consider that. Consider writing up, maybe you did a poster session at a conference or something, consider writing that up as a short blurb. We have all different types of articles. We have original research articles, we have teledermatology articles, we have skin cancer articles. So nothing is off the table as long as it's well written and it's something that we need. It's something that we need to put out to educate the public. So think about that in terms of being able to volunteer as another means or a way to kind of help increase or enhance your visibility within the profession, or to help to get into the profession. Another reason why volunteerism is a good idea, if you're looking to kind of get more active or to have more professional engagement, is just the professional networking aspect. I mean, getting to know your colleagues, getting to understand where people live, what dynamics they deal with, maybe what patient demographics they work with. You never know when you might need an allergy or immunology consult. So imagine professional networking as being a way for you to kind of get your foot in the door to network with other like-minded professionals, or maybe other like-minded professionals in other specialties that are coinciding with the field of dermatology, right? There's allergy and immunology that's big, especially for dermatology when you talk about atopic dermatitis patients. There's rheumatology, which is extremely important when you're talking about dermatology, right? I think about Sjogren's syndrome and systemic lupus erythematosus being good rheumatologic, dermatologic diseases, psoriatic arthritis, maybe the impact of psychiatry on a lot of these dermatoses. I mean, there's a lot of neuropsychiatric diagnoses as well that affect patients in dermatology, such as like scabies or delusions of parasitosis, acne, just the psychosocial aspect of that, or psoriasis. So there's so many different things that you could do or you could consider in terms of becoming more involved, and how that professional networking may expand maybe your horizon or your ability to enrich yourself in some of the other things that can kind of cross boundaries or cross borders when it comes to dermatology. It doesn't have to be only about skin. It can be about the joints and how that relates to this. It can be about, like I said, like acne and how that relates to the psychosocial aspect on self-esteem, or even atopic dermatitis and how it reduces the quality of life in those that suffer from it because they can't sleep because they itch so much. It doesn't just have to be dermatology professionals. I mean, you can be an allergy and immunology provider. You can be a rheumatology provider. You could be a psychiatric provider. So just thinking about the ways that you can professionally network with your other colleagues that can help to enrich your professional life. So some of the other things we talked about during the conference today, during the meeting today, was how to engage the membership, how to engage those people that are following us on Twitter, that are following us on LinkedIn. And what I would say is that I kind of just want to know from you guys, what is it that you guys want to know? How do you guys want to engage with us? Do you guys want to engage with us in more live sessions? Do you guys want to engage with us during podcasts? Do you guys want to engage with us like an Instagram live? How do you want to engage with us? Do you prefer to engage with us at conferences? Do you prefer to engage with us via a Zoom or Google Meet? How can we better serve you as the membership of the Dermatology Nurses Association? How can we better serve you as a member or a subscriber to DNP-Derm? How is it that I can help you to help yourself to become more involved, to be more engaged, to have more enrichment in your professional life? So I'm going to kind of throw out some of those questions to everybody. Hopefully, if you have any answers or any feedback, you can leave it in the comment section, and I will certainly take a look at that. Overall, the meeting was very good. I look forward to this year and some of the things that I think that we're going to be working on to kind of help enrich everybody's professional knowledge and database. And I hope that by me posting this on here, we can get maybe a couple new peer reviewers that might be interested, which doesn't require a lot of time or effort to do, and you won't have to review a ton of articles. You have the ability to accept or reject articles. So it's really when you want to do it and how you want to do it on your time. There are deadlines, but for the most part, you can kind of pick and choose which reviews you want to do and which ones you don't. The more you do, obviously, the more you'll probably get. The timely return of those reviews will also probably get you more reviews to do. But consider that as a way, like I said, to kind of get into the profession, to step in the door of the field of dermatology. So really, this introduction, besides talking about what we talked about at the annual editorial advisory board meeting for the JDNA, was also to kind of promote myself as someone who is here to coach you, someone who is here to kind of mentor you and guide you through what it is that you need to know. I am looking forward to engaging with you here on YouTube, but also engaging with you in a more personal and intimate setting via Google or Zoom in a coaching session. So feel free to take a look at my website. It's dnpderm.org. You'll be able to book coaching sessions. You'll be able to book speaking sessions and really interact a little bit more with me. The purpose of this YouTube page is to both promote my personal website, DNP-Derm, but also to just make people aware of what it is that we as dermatology nurse practitioners do, we as dermatology advanced practice providers, we as dermatology healthcare professionals do, some of the things that are going on that are relevant in the industry, and some of the things that are just going on with me personally in terms of what I am involved in, what it is that I do in my spare time when I'm not at work, 8:30 to 5 o'clock, Monday through Thursday, seeing clinical patients, to kind of give you an idea of what it's like behind the scenes for myself. So if you're somebody who engages with me on my website, you might not kind of know how it is to actually talk to me or who I am as a person. And so this format allows me to be able to kind of be a little bit more intimate with those who choose to engage with me on this platform. I recognize that some people prefer things like this. Some people may prefer a one-on-one session. Some people might prefer to just have a casual meet and greet, via just looking at my website. So I hope that whatever I've said to you guys here today has been informative. I apologize if I maybe didn't have a flow or a format. I pretty much didn't create an agenda or anything or a list of topics to discuss. I kind of just got on here and just kind of free willed it, so to speak. I think that is a more authentic way to interact with you as an audience. I don't want to feel or sound like I'm scripted. I really just kind of using this as a video journal or diary to kind of let you guys know what's going on and what it is that I'm doing and how it is that I am trying to impact the field of dermatology, both on a local level and both on a national level and on a personal and professional level as well. So it has been fun talking to all of you. I will be sure to post very soon. I hope to be posting maybe again in another month or so about another big thing that I'm working on. If you are in the Tampa area, we are doing a procedural conference next week at the Academy of the Holy Names on Bayshore Boulevard. It is from 9 a.m. to 6 p.m. There will be 2 product theaters sponsored by 2 leading pharmaceutical companies. Myself will be there speaking about atopic dermatitis. along with Margaret Bobanich, who will be talking about psoriasis, and Dr. Simmerman, who will be talking about staff retention and recruitment. And then there will be a procedural workshop led by Dr. Crumpton, who is going to show everybody how to do simple and punch biopsies and excisions and things of that nature. So if you're in the Tampa area, if you haven't signed up for it yet, you can go to my Instagram page, which is DNP-Derm. You can follow the link to go to Eventbrite to sign up for the conference. I still think that we still have seats available. So if you're going to consider doing that, I would definitely do that now. The plan is for us to have an annual conference every year. So I think that the surgical and procedural conference will make an appearance again next year. If you miss it this year, I apologize for that. I didn't even think to come on YouTube and promote that as I've been promoting it on my Instagram page. So I apologize, but that would be a perfect chance for you guys to get a chance to meet me in person, as well as a bunch of other dermatology nurse practitioners who are in the field. And it could serve to be a very good jumping off point for anybody who needs to learn kind of like the basics of the procedures that you need to know in order to be successful in dermatology, but also to get into the field of dermatology. So consider doing something like that. If you can't make the dermatology and procedural conference, that's fine too. Like I said, we're hoping to probably offer it again next year. Maybe if it's as good of a success as I think it's going to be, maybe we'll offer it more than once a year. But for now, we're only offering it this year for that. But there are other conferences that offer procedural workshops. So if you're somebody looking to get into the field of dermatology, I would highly suggest that you get that hands-on experience, or you get that training and utilize that time at conferences to ask questions and to gain some of those skills. All right, well, that's all for now. I'm so glad that you guys turned into my YouTube channel. I hope to interact with you here as well as on Instagram and Facebook. And I hope to see you on dnpderm.org, booking those coaching sessions, booking me for speaking engagements so that we can talk on a more personal level and get you going on your road to success and help you out in terms of talking to your workers, your employees, your students, or your membership about all things dermatology. All right, everybody. I hope y'all have a great rest of your day and enjoy the Super Bowl tomorrow. Have a good day. Bye-bye.